I think men feel shame around a lady illness and one that should be easy to fix. I know I did. I bought into the idea that this, as a man, I should be able to deal with this and get it fixed. The reality is that it has brought me to my knees in pain. My name is Jason, and I have a chronic UTI. I'm almost 60 years old, and this is not an illness I ever expected. It all started in July of 2022. I drove to San Francisco Bay Area from Southern California, where I live, and I was headed to visit a friend who was in the hospital. Um, COVID was still very present at the time. And on the drive north, it crossed my mind that I might be passing a kidney stone. I have a history of kidney stones, and I didn't feel well. And by nightfall, I had a fever and started to wonder what I should do. So I called an advice nurse with my medical plan, told her my symptoms, and she told me to immediately go to an ER. Uh, Coincidentally, I went to the ER where my friend was in the hospital, and I ended up spending that July 22nd there for many hours. It's now October of 2024. In hindsight, the general conclusion is that the bacteria was introduced to me during a routine medical procedure as a pre-op for a prostate reduction. And that ER doctor sent me off with some antibiotics because there was no culture yet. She did her best guess on what it would be. Turned out to be the wrong medication, and I got very, very sick over the next few days. And when the hospital got the culture back, they called me right away, and I got the right drug, and I felt better within about 8 hours. I mean, it was remarkable. You apply the right antibiotic, and boom. Unfortunately, over the last 27 some odd months, I have seen at least 6 doctors. They've been general practitioners, urologists, infectious disease specialists. I've had 12 different monotherapy treatments. And that means one antibiotic at a time. None have eradicated my infection. When I am at my worst physically, it's pretty ugly. And if you have a chronic UTI, I don't need to tell you what it's like. What is hardest is convincing doctors how bad it gets. Most people with a UTI are treated and the problem goes away. I suppose that. I had never had a UTI, so this was all new to me. And I would say that at least until recently, I have been dismissed as being exaggerating my symptoms. I've been ignored. I have gotten depressed, and I have actually gotten suicidal around this. I've come to appreciate that the fever is really what puts me over the edge. And I've even gone through periods where I've thought, I'll just let my body kill the bacteria on its own. And wow, that is that's the ugliest. At this point, I have close friends who understand that I am on a journey and that I have good days and bad days. I only very recently confessed to 2 of my very good friends that I have gotten close to calling a suicide hotline. Both of my friends were very supportive. One helped me to see that the bacteria may actually be impacting my thoughts, which I had never really considered. And that made so much more sense to me. Like, I have a great life. I'm generally very happy. And as soon as I get a treatment and feel better, the dark thoughts and suicidal ideation evaporate. I do still get down sometimes when I think this might go on for the rest of my life. But that seems natural to me. Yeah. And finding the Live UTI free interviews on YouTube one night in utter desperation made a world of difference to me. And finally, there were healthcare professionals and researchers speaking directly to my experience, and suddenly I didn't feel as alone. At the moment, I am stable, though not 100% relieved of symptoms. I take a maintenance dose of one antibiotic that is double strength. I have yet another appointment with a new urologist in the hopes of finding someone willing to try treating me with more than one antibiotic at a time. I have no personal evidence this will work, but if you look at conditions like HIV and cancer, they are often treated with what they call drug cocktails. And my opinion is, why not a UTI? I also recognize, and I've had this conversation with my primary healthcare provider, that is not protocol, um, nor is staying on a large dose of an antibiotic on a daily basis, particularly current protocol. But I don't really have an alternative. So I don't think my story is particularly unique, as I can tell. What may be unique is that I'm willing to talk about it. I think men feel shame around a lady illness and one that should be easy to fix. I know I did. I bought into the idea that this, as a man, I should be able to deal with this and get it fixed. The reality is that it has brought me to my knees in pain. I have wept, very embarrassed to call a doctor after he gave me something that, in his words, should take care of it. To me, it was, what was I doing wrong and why wouldn't it go away? In the end, I realized I was not doing anything wrong, but it took me a very long time to understand that. Here's what I know. In this process, I need friends in my corner, friends that check in on me from time to time. I finally asked a male friend to accompany me to a doctor just so he could hear what was said and what I was saying and make sure I wasn't leaving anything out. I'm single, so I don't have a spouse, but bringing someone with me to a doctor's appointment helped me a lot. Obviously, if you have a spouse, that's helpful, or a significant other, that's great. But just having someone in that doctor's appointment who has seen me at my worst or spoken to me when I'm at my worst was helpful because they understood. And doctors, they want to stay neutral. They don't want to get involved, so to speak. I respect that, but by the same token, I did not feel heard, and so it was helpful. I mentioned that I'm single. I divorced 5 years ago, so that was long before this UTI happened. But here's what's really weird is I don't feel like I'm qualified to date. I can feel really good one day and lousy the next. Plus, I truly don't know what healing looks like. What doctors have said is that I have limited options for antibiotics. I've tried one as a 14-day injection and again as a 42-day infusion treatment, and those didn't work. The maintenance one I'm on, and then there are two others that they want to reserve in case I'm ever on a drug, an antibiotic that fails. And that's kind of grim, but it's my reality. Like, I'm not saying it to garner sympathy. It's just the reality that I had to face. And I don't obviously know what other people have in terms of antibiotic options with respect to their particular bacteria. But I'd rather know the facts than kind of just assume they're going to figure it out because, like, they're not. I also have two autoimmune conditions. Both are controlled. This UTI has forced me to thoughtfully evaluate what's important in my life. I know that when I get really sick, I need to reach out to my support network. And I also am committed to finding a doctor who approaches UTIs with some measure of innovation. Um, there are better testing methods, and I truly believe there are medical professionals that take UTIs more seriously than others. In fact, just the other day when I was talking to my primary healthcare provider, his attitude is most urologists have a specific set of tools and approaches that work for the vast majority of their patients. When someone like me comes along with a UTI that they can't just clear quickly, they sort of don't know what to do. And in my experience, doctors don't particularly like to admit that they don't know what to do, but that's just my opinion. My sincere advice is to stay committed to your wellness journey. Take your medicine when you're supposed to. I do. No one ever said to me life would be easy or that I wouldn't have medical problems, so I don't feel persecuted. But as I learn more about how the bacteria is causing my infection manifests itself in my life, the better I can adapt to it. I won't give up, and I ask you to not do the same. Thanks for listening.
Hi, I'm Bianca from Love. I hope you found this video helpful. There's no single approach that will work for everyone when it comes to health, so I invite you to watch more patient videos here or read more stories over on our website, liveUTIfree.com, and take what resonates with your journey. Remember, it's always best to consult with a clinician before trying something new. If you'd like to share your own story, please get in touch. Our info is in the description. And feel free to reach out with any question about patient stories, finding a clinician, or your own personal experience. Also check out the description below for more helpful resources. If you find these videos valuable and would like to support what we do, don't forget to subscribe and hit the bell button to stay updated when we post new content. Thanks so much for watching and for being part of this community, and remember, your story matters.